Hi, it's Dr. Elisha Van Dusen with New Hope Chiropractic. What is brachioradial pruritus? Well, this is also known as itchy arm, and it's a neuropathic skin condition which is characterized by persistent itching, tingling, or burning in your arm, especially over the top of the back of your forearm. This condition usually affects middle-aged people with a higher prevalence in women. Chronic itching, of course, can be a significant disruptor. It can disrupt your sleep, daily activities, impact your quality of life, and cause pain is just as bad as pain, just as much of an annoyance. And it can go on for years, actually, similar to other neuropathic conditions. So what causes it? Well, due to abnormal nerve stimulation, which is basically irritation or compression of nerve roots coming off your neck, especially the lower part of your neck, especially compounded by UV radiation, which causes nerve damage in the corresponding skin areas. Also, things like disc herniation in your neck, spondylosis, joint dysfunction in your neck can make the nerves hypersensitive, making them more likely to misfire. Neuropathic itching basically arises from damage or dysfunction to the central or peripheral nervous system rather than direct stimulation to the skin, and affects the sensory nerves, specifically fibers known as pruriceptors. They transmit itch signals, and they're distinct from pain-sensing nociceptors and proprioceptors. So you have nerve firing, mechanical, metabolic, inflammatory nerve damage or dysfunction, and that can really occur anywhere in your nervous system. So who gets it? Well, basically people with necks and arms. Like I said, it affects people with middle-aged adults, especially women, and people with prolonged sun exposure and problems with your neck. Outdoor enthusiasts and those in tropical climates are at higher risk due to skin damage from UV radiation. Also, it is a little bit worse in people with lighter skin tones. So what are some of the symptoms? Well, you have intense itching, especially in a small localized area, burning sensations too, and again they're along the back and side of the forearm. Also, they're worse at night due to sleep-related physiological changes that alter skin function, reducing anti-inflammatory responses, and also decreases sensory inhibition. So most of the time it's also on both sides. So how do you treat it? Well, chiropractic care is an excellent way to deal with this because it addresses the cervical spine, addresses your neck here, and with adjustments you can decrease this dysfunction, the nerve pressure, and that gives you symptom relief. So things here, chiropractic interventions are, of course, most importantly adjustments, specific adjustments to the neck. The vertebrae is out of place, putting pressure on that nerve. Traction too, pulls the spine apart, gets pressure off the nerve and the disc. Exercises are really good too, and this eventually will decrease the symptoms a little bit and can possibly produce some beneficial effects here. And some good self-care you can do as well, along with the chiropractic adjustments, are head retractions, where you're bringing your head back, straightens the neck, improves your posture, and gets pressure off those discs. Pectoral stretches, where you're doing stretches of your chest muscles in a doorway or a corner. Also use SPF 30 plus sunscreen, wear protective clothing to minimize the sun exposure, the UV exposure. Manage your stress, of course. Deep breathing exercises, proper sleep, getting 7 to 8 hours of sleep. Use ice, that gives you temporary relief. Capsaicin cream is also really good. Decreases the inflammation and also improve your ergonomics. So if you're sitting at a desk a lot, for example, make sure your screen is up at eye level. Make sure your forearms are even with the desk and the keyboard, and make sure your using an ergonomic mouse. And all these things will help along with the chiropractic adjustments to get that pressure off the nerves and balance the nervous system, especially the nerves going from your neck through your shoulders down to your arms. Check us out at newhopechiropractic.com, and if you have this condition or know somebody who does, I highly recommend you at least give chiropractic a try to see if it can decrease your symptoms. Again, that's newhopechiropractic.com, and have a healthy day.